This is the equipment required for attaching a chest drain to a pigtail drain. 1 Chloroseal-3 chest drain, 1 cook connector for pigtail drain, 1 bottle of sterile water, 1 pair of sterile gloves, 1 dressing pack, 1 large alcohol wipe, a thoracic suction regulator with filter, and 1 packet of sterile suction tubing. Carry out hand hygiene using the ALIF technique. Confirm the patient's identity, explain the procedure to the patient and gain verbal consent, and assist the patient into a comfortable position to access the chest drain. This is the Argyll Chloroseal-3 chest drain system. It consists of a drainage chamber, an underwater seal chamber, and a suction chamber. Fill the underwater seal chamber up to the line, normally 110 cc of sterile water, and close the cap. Fill the suction chamber with the prescribed amount of sterile water to the prescribed vacuum level, usually up to 20 centimetres. The amount of water placed here determines the amount of suction that will be applied to the pleural space. The tip of the chest drain tubing is sterile and covered by a red cap. Decontaminate your hands again using the ALIF technique. Set up a clean dressing trolley opening the dressing pack, sterile gloves, an alcohol wipe, cook connector and suction tubing onto the trolley. Using the aseptic technique, with one hand, hold the tubing with a piece of sterile gauze. Then using the other hand, clean down the pigtail drain and tap as far as the drainage bag with the alcohol wipe. Clamp the chest drain by pushing the blue tap into a downwards position and remove the drainage bag. Attach the cook connector to the pigtail drain. Remove the protective red cover from the chest drain tubing. Then attach this to the patient's chest drain. Unclamp the chest drain as demonstrated by pushing the blue tap in an upwards direction. Make sure that the white tap on the cook connector is facing downwards and position the chest drain as far below the patient as possible to facilitate drainage. Ensure the patient drainage tube is straight and dependent loops do not form which can impede drainage. This is training for areas with wall suction points. Suction is delivered via a high volume, low pressure suction thoracic-ometer regulator, which is different to the regular suction. It works by increasing the negative pressure, aiding lung re-expansion by sucking fluid and air out. Attach the suction regulator to the vacuum point on the wall. Next, connect the suction tubing to the suction regulator. Then attach the suction tubing to the suction outlet on the chest drain. Turn on the suction and adjust the vacuum so that gentle bubbling occurs in the suction control chamber. Usually between 5 to 20 kPa is all that is required. This is training for areas using the Medela suction unit. The suction unit is obtained from ICU. You will need a Medela filter and a right-angled coupling piece. Attach the Medela filter and right-angled coupling piece to the Medela suction unit. Attach the suction tubing from the Medela suction unit to the suction chamber. Switch on the suction unit, press start, and turn the dial until there is gentle bubbling in the suction chamber. This is training for the removal and replacement of a collection chamber. Decontaminate your hands using the ALIF technique and then apply personal protective equipment consisting of gloves, apron and a visor. Hang the chest drain to the side of the bed. Then remove the floor stand and place an Inco sheet on the floor. Clamp the chest drain by pushing down blue switch of the pigtail drain or by applying chest drain clamps. Rotate the collection chamber clockwise and carefully pull down to remove from the manifold. Securely cap full collection chamber with screw-on cap. Insert replacement collection chamber into the manifold and rotate counterclockwise until chamber snaps securely into lock position. Then replace the floor stand. Open the switch on the chest drain by pushing the blue switch on the pigtail drain upwards.